Good evening, everyone. I am Kristen Hassan-Auerbach from Pima Animal Care Center, also from the Board of the National Animal Care and Control Association and the Executive Committee of American Pets Alive, here with Dr. Ellen Jefferson. Ellen?
Hi, I'm Ellen Jefferson. I am the Executive Director of Austin Pets Alive and American Pets Alive.
We are here tonight. We have been meeting with you every week from 6 to 7 Pacific Standard Time, 8 to 9 Central Standard Time. And we're here just to talk about the latest updates, what's going on with COVID-19 when it comes to animal sheltering, and what are the emerging issues. So we're going to talk about a lot of things tonight, but we are mostly here to answer any questions that you have. Ellen and I both have the benefit of meeting with national experts, from vets like Ellen to national leaders to even international leaders who are dealing with COVID in other countries. So we're getting to talk to a lot of folks and learn a lot. So we're here to answer any questions you have, and we are watching that chat box for new questions, and we're monitoring Facebook. So go ahead and ask us any questions you have. But before then, Ellen, I thought it would be a good idea if we could start out every one of these giving a shout out to somebody who's done exceptional work. So my shout out this week I wanted to give to Catherine Shinar of the association, AWA, who has done a really remarkable job. 4 weeks ago, I think she called me, and I didn't know her at all, and she said, I really want to bring everyone together over the next, and bring all the national orgs together, and I want to do things differently so that we really can address this. And over the last 4 weeks, she's every single day been working to bring everyone together to really try to solve these huge problems like food shortages and getting reliable vet information. So my shout out tonight goes to Catherine Shinar at AWA. So thank you for all of that, and thanks for including us in those conversations as well. Do you have, Ellen?
Yeah, there's so many though. There's so many people doing such amazing work. Watching the forum, I'm overwhelmed with the amount of progress and just the positive spin people are putting on this and turning it into a win for their organization. I know that there is, I'm going to butcher the name of the organization, so if Mira is listening, sorry. But her organization that transports dogs from the south to the north, they've been doing adoptions in DC and still have 1,000 people waiting for dogs to adopt from them. And they're trying to fill those homes as fast as possible with those homes with foster pets and adopted pets. And it's just outstanding that she's been able to keep the lifeline going from the south to the north for those animals, and doing it in a way that doesn't affect people. So really, really cool. They had a massive event.
That's Mira Horowitz?
Yeah.
Cool,
yeah.
That's amazing.
Yep.
Yeah, so there's so many superheroes. We could probably do this the whole hour, but if there's anyone you want to recognize too, we want to hear about them, because there's all these unsung heroes that are doing these exceptional things around the country, and we don't even know about them. On the animal control page, it's been really remarkable because we asked officers what their biggest worry was. And a lot of them said things like, well, we only have 2 officers for a community of 600,000 people. And if one of us gets sick, we won't be able to save lives. And it's just wild to think about that being someone's concern, and all the work people are doing right now to help animals is amazing. So I think we want to start with a topic that's come up a lot this week, which is that coronavirus itself alone is bad enough, but what happens, how are we planning for the job losses that are happening? I know I was talking to someone in disaster management who said that in Las Vegas alone, something like 230,000 jobs were lost over just a few days. What is that going to mean for animal shelters? And Ellen, do you think we can even plan for that? Or do you think it's better if we just go day to day and try to not even think about what is going to come over the next couple months?
Well, I think for the nonprofit organizations that are out there, they need to be applying for the Paycheck Protection Program. It is launching, the application's launching on Friday morning, and it's a program that you go through your local bank, and it's all online. You don't go into the bank, and they are covering basically 2.5 months of payroll and expenses like rent. And so that's massive, and it's first come, first serve. It's $2 trillion, so hopefully that money will give everybody a boost. But all the organizations that have already laid off people, basically the loan is forgivable, meaning that it's basically a grant as long as you don't lay off people. And for the organizations that have already laid off people, as long as you bring them back, you get to keep the money. So I would strongly recommend that anybody who has already had to lay off people and downsize because of this, apply for this right away and get that money in the door.
Can you say the name of that one more time?
Yeah, it's the Paycheck Protection Program. And it's part of the big stimulus bill that went out earlier this week. And we're applying for it. Everybody, you know, lots of small businesses, for-profit small businesses are applying for it, and every nonprofit is eligible for it. So it's critical that people apply for it so we don't lose the workforce of people that can help animals in the future.
Yeah, I mean, our organization had this week, we had to, we went under a lockdown or a stay-at-home order, and we had to ask employees who were not essential to stay home. And for us, that only meant 6 people, but it was pretty devastating to the team nonetheless, because it brings up a lot of fear and uncertainty about what's going to happen to other folks. Do you know, have you heard of any strategies, or are you guys doing anything to sort of protect the team? Because a lot of people are having to lay off 25 and 50% of their staff. Are you doing anything in that area to kind of try to keep people feeling secure and okay?
I mean, it's really hard because I don't think any of us feel secure and okay right now. But this Paycheck Protection program is going to be a huge help if we can get it. And we're working on, you know, everybody's world in our organization is changing. All of the teams, the work they did 3 weeks ago is completely different now. And so we're trying to sort out our org charts for each department and what that looks like so that we're making sure we're utilizing people to the best of our abilities. And I think in that, there's some comfort that the positions are needed. They're just needed in a different way than they were before. So so we're actively working through that and having meetings with our whole staff and trying to you know, make everybody understand that we're trying our best to make sure that we all get through this. It's hard though. I don't have a great solution.
You taught me something, which I think has been one of the most valuable things I've learned for managing a team right now, which is you were holding daily Zoom calls with your management team 7 days a week. And we started this week, and oh my gosh, it has made a huge difference. And we also started all staff Zoom meetings. It's like people are so afraid, and we're seeing less of each other. So you don't realize how many unanswered questions. What do you think's been the most valuable part of having those daily meetings has been?
It's so eye-opening because, you know, we have a all manager meeting once a month, and there's not enough time for everybody to give an update of what they're doing because it's like 30 people. And these calls have been so great because we've been able to quickly shout out things that other teams need to know and then move on. And so we're on the phone for maybe 30 minutes. Today it was 6 minutes. And so it's just a really quick huddle of, okay, here's the important things that everybody needs to know from me, and then who's got an update that needs to be shared. And it's been a game changer. I mean, I'm actually loving it because it's just a touch point, and I think it's really brought our team together in a way that we couldn't have accomplished. Well, obviously we couldn't have accomplished it now with in-person meetings, but it just feels so onerous to bring that many people together in the middle of their day. But when they're short like this, it's just a quick hit, and we're collaborating so much better across the teams because of that quick communication. We tend to work in silos, and now it really feels like we're not.
Yeah, it's like it's sort of like, I think the thing that I think has changed is that when you have to take a moment and you have to set up on a Zoom call, you have to see people's faces, and like, you have to kind of stop what you're doing and pay attention in a way that I feel like even in our staff meetings, we don't always do. When I'm having a normal staff meeting, I'm writing emails, I'm trying to focus, but I'm pulled in a million different directions. And it's almost like these meetings bring that laser focus, really like you just have to think about what's coming next. And I feel like for our team, we held one actually for all volunteers today, which felt really scary to me because I didn't know what would happen when we got all of our volunteers on a call, but it was really awesome. They got to ask questions that have been really bothering them. And the biggest thing they did was ask how they can help. And so I think the Zoom calls with groups are great. So that's just one strategy I wanted to touch on. So moving on to what is happening in shelters around the country, because we have this amazing American Pets Alive Shelter and Rescue support page, but the experiences are vastly different. They're like, either my shelter is shutting down, closing all adoptions and foster, and no volunteers can come in, or my shelter's moved to appointments, we're emptying out the shelter, we're helping more animals than ever. What do you think is causing the disparity from these dramatically different responses shelters are having?
I think it's because everybody is in a position of having to wing it. I think that NACA has done an amazing job of providing guidance. We've been trying to provide guidance with the American Pets Alive guide, and I know other agencies have as well. It's just that I think it shows more than ever that we're not a united front, and so we don't really know how to react as a group, and everybody does their own thing, which I think is important to do because we're all in different communities, but it's also, it makes it really hard to keep tabs on what's happening with other shelters. And I know for our organization, we're unlike a government-funded shelter in the sense that we're trying to help shelters not have to euthanize. And it's really hard to know, like, it's just a case-by-case basis, trying to figure out what people are doing and what their local rules are. And it would be really fantastic if at the end of this, there's some sort of national support for shelters that can help governments navigate this a little bit more easily. I think animal shelters tend to be the forgotten entity within the government anyway. And I think this is an example of it where there's rules, and I think governments are trying to be inclusive of shelters, but there's really not a lot of guidance around what those inclusive words are and how do you define them and how do you put them into operational work. So I think that's it, is that we're not all under an umbrella. And I'm not, again, I'm not advocating for that, but I think that everybody in the lay people world probably believes that animal shelters have some sort of umbrella organization that guides them. And I think things like this show really clearly that we're all just, marching to our own drummer, which again is probably okay. So, yeah.
Yeah, I worry. I mean, I'm seeing shelters closing down, saying no more adoptions, no more foster. What is happening to those animals? Like, are there alternatives to indefinite holding and then euthanizing for space once you get full? Like, once you stop outcoming, can we even speculate as to what is happening to those animals?
We've been reaching out to shelters that we've heard are struggling and maybe euthanizing, or got an order to stop altogether, stop all outcomes, and then but are continuing intake or already had a full shelter when that came down. And it's been interesting how few are euthanizing now. I think that's really good. And I don't know if it's because there was this preparedness push and people got animals out of their shelters and they started with a little bit more emptiness, and the community has been so supportive. But I'm worried about the next couple weeks as intakes continue to trickle in. I know some shelters, even though they're shut down for intake, some government funded shelters are shut down for public intake, they're still have people showing up at the front door and having, these horrible sob stories. And of course they're coming in. And so if we have an imbalance between the number of animals that are coming in and the number that are leaving alive, there's going to be a bottleneck at some point. It may not be today, but it's not sustainable. And we know this is going to go for a long time. So
yeah, we took in today alone 15 parvo puppies from 6 litters, groups of 2 and 3, and it was really a reminder that this is just starting. And I think it's such a weird time of year for all this to have happened, because it's that moment, that's that calm before the storm we all feel anyway, when we know the intake dam is about to break, and today was kind of a reminder that it's coming, and that while we need to keep our populations down, we need to be able to serve those animals, because there really is, when you think about parvo and distemper, they're not those illnesses people are safe from, but really keeping those pets in the community does cause public health issues, right? Like, if shelters aren't there to take in and help those animals, that can spread among larger and larger populations of pets, right?
Yeah, absolutely. And I think it's really fascinating to think of the options that are open now if shelters don't take those animals, that there are people in the community that may help with treatment, at-home treatment for parvo. That's something that I know a lot of organizations have been offering over the years. So I think, you know, one of the things that is troubling about just closing intake is the lack of resources and lack of information that the public has on how to solve their own problems, because we've trained everybody so well to use the shelter as the problem solver for everything. And so I think that this is an opportunity for us to really think about how we can offer services to the community that don't include touching them or being within 6 feet of them, but also can provide some help so that animals aren't just left, like you said, causing more problems out there. But I haven't, you know, I think it's really interesting. I'll share some data that we got from Austin Animal Center today, which I think is fascinating, is that they have been calling all of the people who have found dog reports. And of those people, the 87% have found the owner in the neighborhood that they found the dog in. And all of them found the owner within 4 days. And it was kind of evenly split across those 4 days. And I think that's astounding. And, you know, I think everybody's fear was, oh my God, all these dogs are going to be running loose and being hit by cars and horrible things are going to happen to them. And the return to owner rate is astronomically higher than what it is in the shelter. The shelter's return to owner rate is 18%. And so all of a sudden there's an 87% return to owner rate for dogs because they're not coming to the shelter. It's fascinating.
Wow. Why has no one done this research before? Has anyone done this research?
I know Austin Animal Center has done a lot of chasing dogs home, and they track how far away they are when they find them. And they've, I don't think they've published anything, but they tell everybody that often they're 1,000 feet away from within 1,000 feet of their home. And if you just sort of bother the dog, they'll run into their own yard.
We've been citing that as a reason to keep pets in our homes, but it seems like we need to be doing a lot more research, because this idea, I was comparing it to like, if you had a journal and you really liked it and you'd kept all your schedule in it and it was fairly important to you, and your neighbor has it and calls you and says, come next door and get your journal. Or alternately, someone takes your journal, drives it an hour away or 45 minutes away to a building where you're going to go have to pay a fee to get it back and talk to a bunch of what you might perceive as bureaucrats. You're a lot less likely to go get it. It's just human nature. And we like to imagine people would go to any lengths to get their animal back, but that's not always true. And that can't mean that those people don't value those animals. It's just that life is hard and people are moving quickly. And for a lot of folks we serve, they don't have cars. So we take away their option to get their pet home. Even if they want it, even if they're like totally willing to do all that, they don't have an option, and pets aren't allowed on public transportation. So we really need to think about that impact we're causing when we're taking animals and putting them in shelters. But the work I think we have as an open admission shelter is, how do we explain to our community that we need to keep the shelter at low capacity, and we need to keep most of the pets in, because all they know is to bring pets to the shelter. Like, that is all they know how to do, and they think that's the right thing. And so not only are they feeling maybe like they're not getting served, but they're also feeling a little offended. Like, I did the right thing, I'm a good Samaritan. How do we get past that feeling that people have that that's the expectation?
I don't know, but they don't have any other options right now. So I think we can, we can start trying to provide education and support and just sort of pointing people in the right direction and explaining statistics like the one I just shared with us about Austin Animal Center. The animal has such, is much more likely to be reunited with their pet. And often that's not a death sentence if they're not, but in a lot of communities it is. And so I think it's important for us to keep that front and center, that you're part of the equation. Picking them up and bringing them to us is not the solution. It's actually the beginning of a bigger problem. And so if we can stop that problem from starting by just reuniting them right there in the field, everybody's part of the solution.
Okay, so speaking of emergency intake, NACA wrote the statement this week on what constitutes emergency intake, but it turned out it was a lot harder to write than I thought, because we were trying to decide, okay, what really needs to come into the shelter? And in reality, the vast majority of pets coming in don't need to. However, because we don't have these additional mechanisms set up to help pets in the community, a lot more do than we'd like. So I have two questions, which I am really curious to hear your thoughts on. How about a cat that's lived in a home its whole life, owners can't keep it anymore. This is a common thing we see, and they bring it to the shelter and they say, I have to surrender it and I got to move tomorrow. Is that an emergency intake?
I don't know. I don't know. I'm not running a municipal shelter, so I haven't had that exact problem. You know, I think if the animal's in danger, then I would say yes. So if the answer that this person's given is, I'm sorry, you can't leave it here, and it's clear that something really bad is going to happen to that cat, then I think yes, it's an emergency intake. But I don't know. I mean, you know, and I think I'll share one more stat about AAC that they shared with me today, is that of those animals that got reunited, I think it was close to 40% found their owners on Nextdoor. And so if we could if we could get better at pointing people to just post their own ads on Nextdoor or do Facebook ads or whatever, appeal to the community, the people around them. We've seen that here in Austin with our Austin Pets Alive adopter page. It's got thousands of people on it. And when somebody has a medical problem and needs to go to the vet, or they need a pet sitter, or there's something bad happening in their life, people rally around them and solve it for them. And it's such a fascinating look at human nature, because if that wasn't people that they knew, like everybody thinks they know each other because they all adopted from APA, even though they don't know each other, they're not judgmental. It's so fascinating. It's so fascinating. And so I think if we can start making those resources where people help each other, the burden doesn't have to be on the shelter to do everything. Like the shelter, for some reason, the shelter has to do everything, and it doesn't make sense because people are willing to help. So maybe pointing those people, you know, would help. I don't know. I didn't answer your question very well.
I do wonder about this. Like, okay, so the back to the person with the cat is like, if we had better community mechanisms, if we had truly helpful self-rehoming kits that could help the average person get a pet rehomed within a week, or our length of stay for cats is like on average 4 days. So if we could really help people do as well as we do, move as fast as we do, and improve that service to them, like, could we figure out a way that they get to us a little bit sooner so they're not in those crisis situations? But we don't just send them home and say, take it home yourself, because managed intakes always given me a little heartburn because people don't know what to do. They're afraid to use Craigslist. They don't want to send their pet to a bad place. And it seems like we need to do a lot of work to really just improve our customer service, helping people keep pets out.
Yeah, absolutely. And I think right now, while a lot of the government funded shelters are low on the number of animals, it's a great time to repurpose staff to do things like that. Maybe handhold somebody through that process and not take the animal in. So just like what Austin Animal Center is doing by repurposing somebody to call all of these found reporters, shelters could do that everywhere. It'd be so great to get more information from other shelters about what's happening to the animals that are being reported as found. Are people figuring it out without the shelter, or are bad things happening to them?
Yeah, I wonder if next week we could get Mark. Is it Mark who's doing this research from Austin?
Yeah, he's working on it. Mm-hmm.
Maybe we could grab him and get him on this call, because it looks like we have a lot of questions, and it seems like we need to interview them about the work, because the word needs to get out. And it's something we've always kind of intrinsically known as true, but it's like, to hear it, like that they're actually researching it, it almost makes me feel sad, because of how many animals we're just ripping out of their community when they could be home. It's like, why are we doing this?
Yeah.
So we have some questions. Dr. Levy, hey, Dr. Levy. So she's asking about, is there a link where AAC has discussed this? No, but we need to make one. So we're going to make sure to interview them this week and get that information out. Someone said, we have an excellent Lost and Found Pets of Fredericksburg Facebook group that's extremely effective in reuniting pets and is partially administrated by a shelter volunteer. That's a great idea. Do you have that in Austin?
We do. We have a really active program. And I think one of the things that, you know, that, and all these APA included, especially when we were a younger organization, there's just so much that's being done by community members. And I think that, again, right now, while there's empty shelters, empty cages, we have an opportunity to actually designate staff to some of these things. And I think one of the reasons we haven't been as successful as we want to be is because it's not seen as an essential piece of the work that we do. And so we don't have staff dedicated to these types of programs, but we should. I think that little bit of information makes it really clear that we should have people dedicated to that constantly, helping people keep their animals. And no, you can't bring them in, but here's what you do. That could change everything for a municipal shelter.
Everything. Okay, so let's talk. So thanks for the reminder about Facebook groups. Craigslist is another place to get pets home. A lot of folks who aren't on Facebook are on Craigslist, and of course, next door, somebody's probably going to throw some shade at you, but you will get a pet home. It's not always the friendliest platform, but it can be really effective. We really need a Nextdoor for pets, and hopefully that's the next thing, is that Nextdoor will come up with a Nextdoor pet section, or we'll develop that on our own, because we need to start working within communities. So someone said, yes, it looks like somebody said that's a great resource. I don't know what they're talking about, field officers. Okay, so the 1,000 feet and the getting pets home quickly is a good resource for officers to know, but how do we message that to the community about how pets really are close to home? Like, how do we show them that, I think is the question.
I think we just need to get the word out. Like, we need to show the study, we need to put infographics out, we need to make sure that 311 has that information, and really message that pets are part of the family. And so, like you said, taking them across town, Austin is a 900 square mile piece of land. It doesn't make any sense to bring an animal all the way across the county and hope that that person who happened to be less than 1,000 feet away when the animal got put in the car, and make it all the way over there. So I really think if people understood that, I think they'd get it. Like, I think if we just message it better, I think they'd get it and they'd embrace it and they'd be part of the solution.
Yeah, somebody's commenting that the community's worried about stray dogs, and then someone else said that everyone in the community, everyone says call the shelter and they'll take the animal in and take it there no matter what, because if you don't take it there, somebody's going to steal it and the owner can't get it home. How do we even begin to dispel this? Because we face this all the time too, that people are really worried. They don't trust the public to help get pets home. How do you think we overcome that barrier?
Well, I think a lot of that comes from the rabies days and the shelter needing the control of knowing every single dog that was loose. And so the messaging around the shelter has to be the one that's notified if there's a loose animal or a found animal, I think is from that era. And then I think subsequently, maybe in the last 20 years, it's been about trying to reunite with pet owners and having one central resource to look at. Because if you tell people, here's the 10 places your pet might be listed, it's really overwhelming. And so I do think that the government-funded shelter should be the place that lists lost animals in addition to others, just so that there is one place that people can look to that is consistently has the most animals on it. Because I remember during the hurricane, there were way too many places with found animals. There was no centralized resource of, if you're an owner and all of a sudden these thousands of animals were found, and people couldn't find their pets because they couldn't navigate all the different places to look.
Yeah, it's easy enough. Like we encourage people to file a found report and to take the pet to a vet to be scanned for a microchip. And it's one of the things we've started doing since COVID is we have our gate closed and we greet everyone up front, and we have 3 things up there. We have a computer to file a found report, we have a microchip scanner, and we have hand sanitizer, and that's it. And we're able to send so many animals right back out the gate. Like, thank you so much. Here's where the pet lives. Can you help us get it home?
Yep.
But we don't even think to do that. We impound them first. Like, we impound them as the first act. And I think part of that is connected to the fact that most pounds had to generate their own revenue. And in fact, many still do. And so if you don't impound the animal, you can't collect the revenue.
Right.
And it's a real problem. I think even there's several cities that come to mind that still their operating budget is based on how much they bring in fines and fees. And that seems like something we really need to change. That's a little big picture, but that's a problem because it's an incentive to bring more animals in.
Mm-hmm. Yep, absolutely. There's a lot of shelters that do, if you show up with a found animal, it has to be impounded. And that's really counter to what we know, even if somebody's willing to hold on to it for that stray hold.
Yeah. So, okay, let's go for it. It's 6:30. We want to talk about the big picture and what the heck we're going to do. So you and I have been on calls all week talking about what could it look like. So let's walk through what, if we were going to totally rethink sheltering, what does a stray dog intake look like now and what could it look like? So do you want me to start with the now?
Yeah, go for it.
You can talk about what it could look like. Okay, so the now, in the average shelter, including ours often, somebody brings us a stray. We ask them where they found it. We get the address. We take the animal in and we process it. We give it its vaccines. It goes into an intake kennel. It goes through the vet office, and then it goes into one of our main floor kennels pending a play group assessment and spay neuter, and then becomes available at the end of its stray hold, pending all of those things. So that's the typical intake now. Our length of stay is actually pretty short because our stray hold's only 3 days. So our length of stay for dogs is about 11 days. But what, if we were going to totally revision how this all worked, what could a stray dog intake look like?
I think it would be similar to what we're seeing right now, where, and maybe it's just more resources for the public to utilize. So if there's a stray dog found, instead of hauling it somewhere, there's a phone number that's really prominent that they call. There's somebody who answers it, and that person walks them through how to reunite that pet with the owner and what to do at each stage and how to keep them separate from your pets, and basically that hand-holding. I think that would be revolutionary, and it wouldn't take any more time than the intake process takes. And it'd be way less expensive because it's a staff person, but then you're not paying for vaccines and all sorts of things. You could offer those. You know, if somebody's willing to hold on to an animal while they're looking for the owner and it's infested with fleas, why not be able to offer flea control to help that pet not just get booted back out on the street? So I just think it could be completely different. And right now, while the door is shut to shelters, we have an opportunity to test out that idea. Like, let's see what happens if we dedicate personnel to talking through the way you reunite pets with their owners, or rehome them if you can't find the owner.
So the way it would look then is that you find a stray dog. You don't have the option to drive to the shelter night or day. We closed drop boxes almost all over the country, thank goodness. In the old days, you could just drive up at midnight and throw a dog in a box and leave. So we've closed those, but now for most shelters, you can come during open hours and you just bring a stray, no questions asked. So that would go away. What you would do is that you would call, and if you have worked in a shelter, you have inevitably heard you never answer the phone. And it's because we're all so busy processing all these animals. So we would actually answer the phone, and right away we would provide you exactly the trajectory you need to take for the animal. And we would triage to determine, is it an emergency? Is it a dog that maybe is a fluffy poodle and can go straight to poodle rescue for holding? And that's really scary for people because I think they still have this idea that the stray hold means it has to be locked in a cage, no one touches it, it's private property, and we're getting away from that now. But that seems to be a real fear for folks. Like, nobody even walks dogs on stray hold. At PAC, we still don't really. We're kind of moving away from that, but this fear somehow of touching someone else's private property really seems to stem from the pound model, and it could impede the effort to do what we want to do.
So what would you do, walking through another scenario, what would you do differently for a hurt animal that is being brought in by its owner?
An owner surrender of an injured pet? Mm-hmm. What would we do, or what would most shelters do?
Oh, maybe just I think we all know what the norm is right now, but what would be the future in your mind?
I think that, so when people bring an owner surrendered injured pet now, we've gotten to the point where we can offer them resources to try to keep that pet. The problems are often pretty complicated. So a lot of times folks, because they're so ingrained to think that all we can do is euthanize their animal, they just come and say, can you euthanize my animal? If it's hurt, if it's 10 years old, it's perfectly healthy, or if it's really sick and needs help. So I think that we need to change that narrative. Like, we don't accept owner requested euthanasia anymore. We don't take it as an intake category. We just take owner surrender because we're trying to change the community expectation. I think what it could look like is that if you have a sick or injured animal and you need advice, you can get telehealth on the phone. You can call and get free telehealth support to know. So a veterinarian can tell you right away, this animal does not need to be euthanized. It needs this. You can determine if there's avenues that you can afford. And if you can't, you somehow sign it up for shelter support programs that may mean rehoming. Like, maybe it's going to go right to a hospice home, or maybe it's going to go to a different foster, but immediately you're triaged from home before it turns into this animal is sick and really needs immediate help in front of me. But we don't have those. And most people, they cannot even afford to go to a veterinarian. So most of the folks we're helping. And so we need better access for them just to get answers, even if it means no service.
Yeah, I think that, right. I think that's a huge problem and something that we overlook in this. And it's always been a problem, you know, back in the rabies days, way back then, people that could afford to get their pets a tag could get their pet out of the shelter, and the people who couldn't. And now, even with the things we're talking about with rehoming or being lined up with resources in the community or having a network of people to reach out to, a lot of that's based on the ability of people to have access to those things. And so I think that it's something we need to really think about as we move forward, and especially if shelters are trying to keep their kennels empty and are trying to embrace a new model of sheltering. How are we going to empower people to be their own savior for the animals without those resources available? Like next door, there's many communities, neighborhoods that don't have next door.
Yeah. I mean, there's a way in which the way that we live such more isolated existences is bad. And it's another impact of COVID. I mean, I hate to say anything good could come from this because it's a horrible, unprecedented national tragedy already. But there's this way in that when we've been living this isolated existence, so we don't even think to go to our neighbor's house. And maybe some of that, I've seen more neighbors out in the last week than I have in the last decade. Maybe some of this means that people actually talk to each other and start helping each other more, because we don't just have those barriers, we still have these barriers where even if the shelter can help someone, they are mandated by fines and fees to not release animals. Somebody just commented about this and said a lot of pets are left in our animal care because the owner can't afford to get the pet out. That has got to go out the window. And especially in this moment, if there are ways around, I emailed my leadership today and said, hey, can we release unaltered animals? Can we try to get a forgiveness on that during this time and release them with certificates? But this is the time to be asking those things, because it's life or death, and it makes no logical sense for a municipality to hold on to an animal that's going to cost them hundreds of dollars when they could just send it home.
Yeah. I have a question for you.
Yes.
Where do you look for reliable sources of information with everything flying around and there's 4 million things crossing our Facebook and email and on the news?
Yeah, so we think that's a great question. So we keep hearing over and over again, read the CDC and the AVMA, and those are great sources of news. They're also the most distilled, simplified, and sometimes a little bit vague news sources, because they're trying to speak to a whole huge audience about the most fundamental things people need to know. So they are the go-to resources, but there's so much more. We're finding that people aren't, probably because they're so stressed, they're not taking time to read and listen to reliable news sources. So a couple of, regardless of your political leanings, the Washington Post, the New York Times, the Atlantic have all had reliable science-based news. And for those of us in animal sheltering, it's really important that we're reading science-based news, and because we need to know, especially in relationship to companion animals, and as more starts to come out about that, it's important we can get to scientifically accurate information. So those 3 news sources are great. I just listened to, the best thing I've heard is a podcast called Ologies, did an episode March 9th called Virology, but it's all about the science of COVID. I didn't know that I'm hearing this, it's the SARS-CoV-2, and I didn't know why that was different than COVID-19, and I learned why. So do you know why, Ellen?
I can't explain it, but Dr. Levy probably could.
Dr. Levy probably does. So SARS-CoV-2 is the name of the actual virus, and COVID-19 is the name of the sickness we get from the virus, and it's named COVID-19 because it emerged in 2019. So it's kind of like HIV and AIDS. It's the same reason there were two names that kind of confuse people, but that podcast was super awesome. So it's a great thing to read. And Mother Jones just had another great news outlet had an article about how this all emerged out of those animal markets. And that's really important for us to understand, because this is all tied to factory farming. It's all tied to sort of horrific forms of animal cruelty, not just in China, here in the United States as well. Remember, many of these other viruses have emerged from factory farmed animals. So this is a global problem of factory farming. That's where these are all coming from. And so that's a great article to read as well. And so, yes, okay. Next, Ellen, what else do we have?
Well, somebody asked if we could talk about how some shelters are not doing adoptions and what the effect might be of that, pros and cons. Do you want me to go? Okay, so I mean, I think that we're struggling, all of us are struggling with balancing the need for public safety and the need for not having any animals die in our shelters. And so I think that goes back to not having everybody have the same exact prescription wherever they are for what their policies and procedures are. I think if we can boil it down to, is this something that needs to happen in order for these animals to survive, then it's probably something that should be done. But we've been working at AMPA, we've been working on a decision tree that can help sort of work through that decision-making process of balancing 90% with 90% social distancing for everything you're doing with 90% plus live release rates, or at least trying to keep your live release rate up to wherever it has been or higher. And I think whatever you are wanting to do, or whatever procedure process that you're wanting to decide to do or not do, should meet both of those criteria. So is it going to affect your live release rate? No. Well, then there's not a need to do it right now. Is it going to allow you to do social distancing at least 90%? Then yeah, if you need it for life saving and you can do 90% social distancing, then absolutely, it should get done. But I think where we're stuck is that there's lots of processes that are happening in the middle there, where you have a 50% social distancing and the animal may or may not die if we don't do that process. And that's where the gray area is. And so I think just trying to really elevate the conversation to life and death and 90% helps to keep it in perspective. And so for those shelters that have their adoptions closed, I don't know that it's a bad thing. If animals aren't going to die, then it's probably not a bad thing. But if it is, if animals are going to die, then they need to find an alternate route for those animals to live, or figure out how to keep them alive until this is over.
Ellen, can we share that link to that? Is that Austin thing?
Yeah.
If we can share that, somebody's asking about where do we find that? How do we find how we define that 90%?
Yeah, we made a little infographic too, so it's a little easier to digest.
So I think this has come up around transport a lot, because people are like, transport's become like the new big debate. It's like talking about the death penalty or something. People like really feel strongly, and I really hear both sides of this. So a lot of the shelter medicine folks say that it's really risky, particularly if you're talking about transporting animals from a highly impacted area to a non, or vice versa. There's a lot of human risk in that. And I also hear folks saying if we don't transport, animals are going to die. So like at PAC, we were doing these wings of rescue flights that were so awesome. They were getting out like 100 animals at a time. We were stopping them because they're not essential to our life saving. We can save lives without them. If I were El Paso and I were looking at immediate overcrowding, I don't know if they are, I'm using that as an example, but a city that if they don't transport, they're going to not get animals out. I think I also understand the argument of, okay, in a case like that, how can we figure out how to safely transport in a really reasonable way? What do you think about this debate, and do you have a take on it, or are you sort of like me and you kind of get both pieces of it?
Yeah, absolutely get both pieces of it. And I think that it's our duty to try to figure out a safe way to save animals locally. And if that's not possible, then consider transport. I don't think it should be the first reaction that we have, but you know, we're stuck in this, and this is what is so tragic about animal shelters in general, is that we're stuck in this 3-day timeline for every animal. And it's such a, it's, you know, the time clock is going to run out and then animals die. And so you're just moving as fast as you possibly can. And so during this, I know that not every shelter is decreasing their intake, every municipal shelter is decreasing their intake, but I hope that they'll do it. I hope that spreads across the country and that shelters are really stopping that so everybody can catch their breath and make good decisions for people and for animals. Because I'm not sure, I think that, you know, I think it's possible to do it safely, but it's a lot of work, and it has to be made, that decision has to be made in a way that is really smart so that it doesn't get messed up.
Do you think that so when you're looking at organizations like yours and mine who are still functioning, are we better off sort of trying to get the local, so we have a lot of little local rescues and they're all basically shut down at this point. Not all of them, but most. They're not taking in any of our animals. Is it better to implore them to continue to help us? Or do you think it's time better spent going to the community directly? Because we're at the point where we're just going straight to the community rather than trying to do that. What do you think? Do you think it depends on where you are, or do you think one is better than the other?
I don't know. I've been shocked at so many places across the country have been able to empty their shelters directly into the community, doing the drive-up fostering and drive-up adoptions, remote adoptions, and it's pretty astounding. And you know, we've always had really good luck here in Austin when there's things like torrential downpours and our shelter floods and the community comes out and takes every animal out of the shelter for the night. I'm floored that every community acts like that. Every type of community has come forward and taken almost all the animals out of the shelter during this crisis. And so I think we've just been doing it wrong. You know, I don't think that we've recognized the potential that's out there on a daily basis, and all we have to do is harness it in a different way. We expect the community not to come forward, and so we're not leveraging them in a way that will help them come forward when we need them. And I'm not talking about a crisis every week, but on a daily basis. It goes back to where our resources, you've always talked about this with your org chart exercise that you've done with different intensives. And our resources are not in leveraging the community to help us with live outcomes. Our resources are in intake and animal care. And it's really kind of astounding how off the mark we are when you think about how many animals got out of shelters in 24 hours over the past couple of weeks.
Yeah. Yeah, it's like, you know, I keep driving everybody crazy with my Teddy Roosevelt 1909 thing, but it really is striking to me that like a split happened in the mid 1800s and early 1900s, and conscious decisions were made at a high national level to not house children in institutions. Those same decisions were not made for animals, and it's why we're here today, and it's also why we don't have thousands of orphanages in the US. And it seems that it's time to really revision how we use this shelter space. We're planning on trying to provide as much community support as we can and revision some of the way we use space. People are going to be struggling. They're going to be out of work, but they're also going to want to keep their animals. And we have to stop saying everyone's going to dump their animal and everybody's going to give them up. That's not what's going to happen. People are going to try like hell to keep their animals. We've got to be here to help them do it and rethink this. And I think part of what we also have to do is question some of our own assumptions. I think even within animal welfare, we're already just expecting people to throw away their animals. And I don't think that's what we're going to see. I think we're going to see a lot of people having a really hard time, but we have brought on a public health nurse to help us, and she's just helping us figure out the human piece, because these are all really human problems. The animals are perfect. They're just part of our human problems. And so maybe we need to dedicate more resources there. Do you think there's a way to do that without spending a lot of money? Like, do you think there's a way that broke animal shelters can actually help solve human problems?
Yeah, the cost to care for animals in the shelter is very high. And that is the biggest drain on any shelter budget. And so if we radically keep our kennels empty like we are right now, think about how much funding is freed up to help people keep their pets and help match up animals with new homes and help with that next door work. And there's just so much we could be doing out there that we're not, because we don't have time and we don't have money. But right now we have time and we have money, and meaning that especially in governments, there's money with people that are already there. I know some are going through layoffs, but I think that also proactively talking to the government about what people could be doing to support the community during this, rather than just saying, well, all our kennels are empty and now our people don't have anything to do. Of course, those people are going to get laid off. But there's a lot we could be doing, and we should be repurposing them now. If this lasts for 6 months, governments aren't going to keep those people on the payroll if there's nothing going on. And so, yeah, I think this is our chance to show that we can keep people very busy and we can keep our community happier, and we can do better by our animals if we're dedicating people to these more community, these outreach efforts, support and connections and networking. It's all related.
I know, it's crazy. It's just like so much to think about. It feels a little overwhelming, and it's like it's just like one bite at a time, right? Of the vegan cookie. Didn't people used to say bite off the elephant? What was that expression? There's some expression about an elephant and biting off one piece at a time, but we have to just take this day by day, and it's these little steps we're taking that it's a little weird to be doing this while we're also like trying to keep our staff safe. And I want to touch on why a couple of weeks ago you all started to move your staff to a split shift, and you convinced me to do it. I was pretty opposed. But we are doing it. It's going to be really, really hard. We're doing half and half. So we'll have on half the time, off half the time. Why do you think this is so important? Like, especially in the places where people aren't truly terrified yet, why is splitting the staff important?
It's important for the decrease in the amount of spread. It's kind of like what we do already with animals and diseases in our shelters, where we're trying to decrease the spread across lots of animals. It's one reason we're a big fan in our nursery of having 3 or 4 rooms that are all in and all out, because if somebody gets sick in one of those rooms, they've only contaminated that room. They haven't contaminated the other 70 kittens that are in other rooms. And so it's partially that. And then the other big problem with it is the amount of time people have to be off if they're exposed to somebody that's sick, because they could take up to 14 days for symptoms to show up. So if somebody on your team is positive, everybody they worked with for the last 3 days before they got sick has to go on leave for 14 days. Everybody that they were within 6 feet of. So that just wipes out your entire workforce. And if you're just mixing, we call it tossing the salad with animals. If you're just mixing animals all over the place in your shelter and spreading disease everywhere, you can't control it. It's the same thing with your people. If they're just like walking over to admin, and then they're walking over to the kennels, and then they're walking to adoptions, and then they're walking in the clinic, that 6-foot rule, it's everybody. So trying to keep them as segregated as possible right now is super important to protect your workforce, to protect your animals. And that's part of the strategy of trying to empty the shelters anyway, is that you can suffer a loss of maybe one team at a time, but you wouldn't be able to suffer all your teams going down at one time, even if you had half your kennels full.
Yeah, I think that's something you and I need to keep talking about, because I think people get a little confused. When we were telling the volunteers, we're splitting them. Our volunteers are considered essential per the national recommendations of volunteers being considered essential. But when we had to explain to them they're being put on the split shift as well too, there was some confusion. And I think it's important to keep explaining to people that there's real reasons for this. And I think the NYPD, I think I read 1,400 NYPD officers have COVID. And wow. It really kind of hit home for me to what we could be facing with our own staffs. It kind of, we've gotten to talk to an epidemiologist earlier this week on our Monday call, And that made me feel a little better. But it also, you know, this is a virus like so many others that we have to take really seriously. And I now that I've remembered that dog leashes are 6 feet, everybody on our team's carrying one, and we're making them lay it out to practice their 6-foot distance. So that and simple things. One of the things we're doing that I think is so important is we're propping open all the doors. And it was something she said to do, but you don't realize how many hundreds of people touching that door in one day. And we're probably keeping people a lot safer just by propping all of our doors. We have tape lined up, so we tell people they have to stand 6 feet back. It's these little mundane things that are going to keep our team safe.
Yep.
We're getting to the end of the time, and we want to remind you that you can join the American Pets Alive Shelter and Rescue Support page. That's for all animal shelter personnel, paid and unpaid. If animal sheltering is your calling and you are considerate your life's work, whether you're a volunteer or staff, that page is appropriate for you. And we're there every Monday morning at 7 a.m. Pacific Standard Time, 9 a.m. for those of you on Central. And those meetings are a little bit of this, except there are about 180 people on those. So it's a giant meeting, and it's a time for us actually to have dialogue and to talk. And we're trying to bring in experts from different fields who can teach us a little bit about this and help us stay informed. So those are great calls to join in. If you're not a member of the American Pets Alive Shelter and Rescue Support page, we encourage you to join. We appreciate you being with us tonight. Ellen?
Yeah, thank you so much. It's good to just sort of talk about these things. And I think that, as Kristen pointed out, there's so many resources out there that they can be confusing. And so it helps to just sort of talk through with people you know. And anyway, we're really happy that you joined us. Thank you.
And Faith asked us to let you all know that El Paso is actually doing great. They've emptied out all their extra kennels. They've had an amazing community showing, but if you know anything about El Paso, it's one of the most challenging cities in the US. So we often use it as an example in their leadership team. We are so proud of all of them, including their director, Paula, who they just fight to save lives in really tough circumstances. So we're happy to say they're doing really well right now. Thanks everybody for being here. We'll be back next Wednesday, and we appreciate you joining us. And as always, if you have any questions, follow that page, and you can ask us most days on that page live. And the American Pets Alive staff is there to answer questions too. Thanks everybody. Have a great night.
Good night.